and welcome to Staying Well with Sunnie Bell. We're so glad you're here with us today. I'm Debbie Johnson, Sunnie's co-host. Sunnie is an author, and that's why we're here for one of her books. She's written several books. She's a registered nurse. She's a certified diabetes educator, and nationally won awards. We are going to have two very special guests today. Our topic is basically our two special guests. Tara Castle is a licensed massage therapist, and Amelia Davis, who is the marble success story. So, Sunnie, would you like to introduce those?
She is, Amelia is a marble success.
Oh, is that what I said?
Among many, of course.
Among many, yes.
Thank you, Debbie, and welcome to everybody. We're glad that you're with us, and we're particularly glad that Tara is here with us today, and we want to kind of rush through the introductory business so that we can get to the important topic that you have today, which is going to be the lymphatic system. I was in having a massage by Tara yesterday, and we got talking about the topic for today, and I told her that years ago when I was in nursing school, I remembered learning that that seawater and blood plasma had the same salt concentration, and it was only, believe it or not, in some of my recent research that I learned this very week that lymph fluid has the same concentrations. So we were able to share that and say, hey, there's always something new. And I want to turn it over to you now, Tara, so you can teach us all about lymph and what massage can do to help the lymphatic system.
Thank you, Sunnie, and thank you again for having me on this show.
Thank you.
First of all, what is the lymphatic system? I'm sure most people are asking themselves. It's not a very well-known system. Of course, physicians and nurses know about it, but ordinary people don't really know about it. It's a secondary circulatory system. So it's part of our circulatory system. The only difference is it does not have any involvement with the heart as far as pumping it. It's a one-way system to clean out our interstitial fluid, which is the fluid that connects all of our cells and keeps our body all together and just regularly needs to be cleaned out. Mm-hmm. And so the lymphatic system is very important in that it filters all of our body's fluids back to the blood so that it can be cleaned and recycled.
And we have a picture on the screen right now to show the lymphatic system. And let me ask you a question, Tara. When I'm looking at that picture right now and I see that concentration of tissue up under the arms, I know that the lymph nodes are concentrated in that area as well as in other parts of the body. And I know from my own experience, this is some of the tissue that you work on.
Exactly. The lymph nodes that you're talking about, those are the main parts of the lymphatic system. And as you said, they are gathered in the axillary region, which is the armpit, the cervical region, and the inguinal region, which is why when you go get a physical, a doctor will usually check your throat. They'll usually check all of your lymph nodes to make sure that there isn't any disease, because swollen lymph nodes is often an indicator of disease.
And not necessarily serious disease.
Right.
It can be.
It can be oncoming.
Right,
disease.
And it can be just a bad cold
exactly.
that your body is cleaning out.
Right, which is still pathogens and
mm-hmm.
you know, bad cells that are trying to get cleaned out. And with the lymphatic system, it's very important for our immunity mm-hmm. because it has the T and B killer cells that go in and help take out cancer cells, and just it increases our immune system. They're the white cells that are found in our blood as well when you get a blood count, the WBC.
Mm-hmm. Mm-hmm.
So those are the cells that all around our body are moving to just try to keep everything fighting disease.
And they're concentrated in the lymph fluid as well as even more so in the nodes?
Exactly.
Okay.
The lymph nodes are basically, like I like to say, they're kind of reservoirs. And then we have all these veins. They're like veins, but they're actually capillaries and vessels in the lymph lingo. But they're just like all the veins running throughout our body. And actually the picture that we saw is only showing a little bit of them. It's just showing the concentration. But they're all over our body. We have them in our face. It contributes to, you know, the fatty deposits we get under our chin as we get older and whatnot, because lymph fluid isn't getting cleaned out. And a lot of people ask me, well, how come our lymph isn't getting cleaned out if it's, you know, a system that's designed for that? The thing is, nowadays, as you know, Sunnie, our toxins are just so high. The toxins that we're exposed to in our environment. Mm-hmm. And so our lymphatic system is having to fight harder and harder. And the only thing that helps the lymphatic system move, like I said, it doesn't have a heart or a pump to help it move. It relies on physical activity.
I was going to ask you about that.
Which creates muscular contractions. And that's pretty much it. Any kind of activity that's around the lymph vessels that can kind of pump them a little bit is going to get them to move. Otherwise, they don't move.
Because they don't have a heart pumping them. Debbie,
Right.
Exactly.
Terry, you're always, when I get a lymph massage, you're always like telling me we can do that ourselves too.
This
to
is
keep
true.
that moving, right?
That's
Okay.
true. And the
How would you do that yourself?
The way I tell people to do their self-care for lymphatic is to pump the main lymph node areas. And the important thing is to always remember, start at the core, at the center, because it's kind of like the big lake. You want if the lake is full, the reservoirs can't drain into the lake, and the ditches or rivers or whatever nothing can keep draining if the main area is full.
Okay.
And so the main areas, I like to tell people, just so it's real simple, as far as massage therapists, it's much more detailed, and we are very conscientious the whole time of the direction and where we're pumping and how the strokes are moving the fluid. But as a maintenance deal for self-care, it's a lot of detail. So it's easy to remember to just think about Tarzan. And remember how Tarzan?
Tarzan.
Yeah, he was so healthy, swinging around on vines,
Yeah.
Well, they say Tarzan was so healthy because he kept his lymph going by going, and beating on his chest.
Believe it or not, I just watched a Johnny Weissmuller movie of Tarzan, like from 1930-something on Turner Classic Movies.
What a
He was
coincidence.
great. No wonder everybody was kind
And
of
she
in love
really
with him.
did. I heard this story.
I can't believe you would say Tarzan.
That's so funny.
So anyway, back to the topic though. So his
Back to the
activity, doing all of that physical stuff, cleaned out even his core,
Right.
lymph.
But the thing with Tarzan is, remember how he would go like this on his chest?
Yeah.
And so that's why I tell people to start. It's hard because I have this
Probably
microphone.
trapping her
Oh,
microphone.
I'm trying to keep away from my microphone. But basically, you just tap in this area, and that starts the subclavian lymph nodes, which then helps drain these lymph nodes. And
Tara, what'd you tell me? There's like 40?
Oh, there's so many, and they're little.
Just in the chin?
Oh yeah, there's so many, and they're just little pea-sized things. They're not huge, so that's how there can be so many of them.
I know you have them in the back of the
You
neck.
do?
One time when I was a young adult in nursing school, actually, I had a case of mononucleosis. They call it the kissing disease, but believe it, I didn't get
No.
kissing. Nobody was kissing me, and vice versa. Anyway, I could feel at that time, this big chain of nodes in my neck, and it took a long time before they finally cleared and got back to a normal size.
Mononucleosis is a contraindication for massage while it is in its acute stages.
Oh,
Actually,
okay.
now that you mention that, it is a disease of the lymphatic system. It's
Oh.
overburdened, and whatever the cells are doing, it's not working, and I don't know all the specifics about it as far as mononucleosis and whatnot.
So, Tara, is there ever a time when you shouldn't get a massage?
Well, if you have mononucleosis, you shouldn't get a massage.
How about another viral type
What-
infection?
what else?
Other stuff.
If you have the flu, if you
What
have
about cancers? When you're going through treatment or something?
right
is
now
that a good time?
cancer, right now cancer, their research is leading to show us that it is beneficial for the cancer patient because, as you know, that's where the cancer is cleaned out through the lymph nodes. And when a woman has a mastectomy, often, most times, they'll remove the lymph nodes in the axillary, or some of them, or part of them, to make sure that it's not traveling and going to metastasize elsewhere.
Metastasize.
Yes, thank you.
Uh-huh.
Elsewhere or in the region.
I got a question on the anatomy of the lymphatic system. So is it closed? Like when the fluid goes into a node area, where does it go from there then? Does it go back into the lymphatic system when you get that moving again? I mean, I would understand that fluid comes into it from the blood vessels in the body, so it's constantly being fed. And then is it like, the Dead Sea, or does water ever go out of it?
There is an exchange going on as it is taking the bad cells out of our interstitial fluid. It's sending in the killer cells, the T and B killer cells, the white blood cells that help our immune system. It's a one-way system, Sunny. So it is just always trying to get everything back to the core and to the heart, and it's drained through the thoracic duct, and then back into the heart through the circulatory system.
See. Okay.
The liver comes into it, the spleen comes into it, even the thymus comes into it because it secretes hormones. But the main anatomy of the lymphatic system are the nodes themselves. The picture that we saw earlier showed the main, the excuse me, I can't remember the name right.
I'm not sure where you're going. Right?
I was trying to remember the main lymph node in the stomach. The chili.
I really don't know. It sounds like maybe after we had our green chili. I don't know.
Whatever that
it's
name
just
is.
slipping my mind right now.
Yeah.
But we always start the massage at that point as massage therapists. But back to the self-care thing, and just want to let you get that on your show. You start here, and then you just tap in your throat a little bit.
Tap or move like that.
The massage strokes are a milking, tapping, feathering.
But you're always
massage.
very light with that.
It's
too.
very light because
Very light.
the lymph vessels and lymph nodes are very superficial. Whenever you get sore throat, your mom always feels your throat, and sometimes you'll have one of the sides will be swollen, and you can help drain that yourself by starting down here and then just lightly tapping, pumping, feathering, just light touches. Helps
My
get it going.
thinking on this, and tell me if I'm right or wrong. So if I have a viral infection going on and my lymphatic system is helping to knock it out, I would imagine those viruses in the nodal areas are getting killed. And so they're going to be breaking down into their components, which at that point they're not dangerous, and they can be moved out of the interior part of that system then, and they can freely go in just to be discharged in normal mechanisms.
And filtered through our...
Yeah. Well, that makes a whole lot of sense.
A lot of times, though, when you do have a viral infection, because there's so much going on, we want to wait until your doctor has cleared you via your treatment with antibiotics or whatever is going on, and gives us clearance to go ahead and give you the massage.
Keeping in mind that antibiotics are only useful in bacterial infections.
Exactly.
Sometimes a bacterial infection will come on after a viral infection, but in the early stages of a viral infection, before it's been demonstrated that there is any bacterial infection, an antibiotic isn't really useful. Now, on the other hand, sometimes they are prescribed at that point, and we don't really recommend that. So is there anything you want to get in? We've only got just a few seconds here before we need to take our break, Tara.
Basically, lymphatic massage is recommended as a preventative measure. It's a lighter massage, and it's kind of getting in oil change. It's recommended for everybody at least every 3 months.
Well, that sounds great to me, and it's very interesting to learn about the different systems. I think that we did talk briefly at one point about the two nervous systems that we have, and we have these two circulatory systems to a point, even though we don't have a pump for the lymphatic system. Well, we want to thank you very much, Tara, for being with us today. And we want to thank all of you for being with us, too. But we're not done. We're coming back in just a moment after a break, so please stay with us. Hi, this is Sunnie Bell. I hope you're enjoying the program, Staying Well with Sunnie Bell. To get your personal copy of the book to follow along with the program, it's available at the following locations: Oscar's Beauty Salon, Coas Bookstore downtown, Amazon.com, and you can get it from me. Thank you, and stay well.
Yourself a beautiful home.
The most beautiful homes in Las Cruces have one thing in common. It's Don Tan Interiors, the local experts in granite countertops and fine kitchen cabinetry. When it comes to home improvement, think Don Tan Interiors.
Don Tan Interiors. Make yourself a beautiful home.
Celebrate, celebrate, Fiesta Motors.
Come and see us today and discover why our service is second to none. In business for over 17 years, we have the right car for you. When you buy a vehicle from Fiesta Motors, we do everything possible to ensure your satisfaction. Located at the corner of El Paseo and Main. See you there.
Celebrate Fiesta Motors, where buying a car is always a celebration.
Welcome to La Buena Vida Women's Club, located away from the crowds but close to home. Come in throughout the day for Jazzercise, the world's dance fitness leader for nearly 40 years. Treat yourself to a relaxing massage, or unwind in the lounge area or outside on the balcony with friends. La Buena Vida Women's Club, located and designed with women in mind. For information, call Diane at 650-9721.
Hi, and welcome back to Staying Well with Sunnie Bell. We're doing things just a little different today. We don't really have a recipe for you today, but Sunnie's going to tell you about some food items rather than give us a recipe.
Yeah, I thought it'd be a good idea just to give some general principles, and I'm going to throw these out real fast because I don't want to take time from our next guest. So when you're deciding what to eat, and there's these three things we can eat: carbohydrates, proteins, and fats. When you're in the carbohydrates, which might be grains, breads, and cereals, look for visible grains, visible cereals, something you can feel in there. When you're in the dairy department of carbohydrates, nothing over full of fat, but not too thin either. We want the balance in there, and not full of fake ingredients that make it seem like it's more fat than it is, but who knows what those ingredients are composed of. On the beans and lentil portion, you can hardly go wrong. Any seasonings are good unless it happens to be one that Larry, your husband, Debbie, mentions all the time, the bacon grease, and we're going to try to leave that out of our beans. Fruits and vegetables, the other carbohydrate, colorful and crunchy is what to look for. In the protein choices that you're making, not with visible fat. If you can see it, cut it off. And not cooked with excess fat. And usually we recommend cooking everything that we are going to fry on the stove with olive oil. And on the fat choices, the third component of food, look for the oils that look for something liquid, not solid. Just think of it in terms of olive oil, or really any oil, compared to hard butter that you pull out of the fridge and it's solid. That means it's saturated and it's not so healthy for you. And also look for the deeper colors in your oil. A very light olive oil is been processed a lot. Look for the deeper color with more greenish and almost looks particulate in a way. Except for natural foods, don't worry about the solidity of natural foods that are high in fat, such as avocados. That's good fat and highly recommended. And then bottom line also is look at quantities. Any of our selections, we always want to keep in mind quantities. And that's it.
I know that we promote olive oil, but Larry came home with the other day with the spray like we talked about, but it was canola oil.
Yeah, canola oil is one of the monounsaturated fats, and it's good, and it's fine. It can be used at times, but we have olive oil spray now too,
so we
and
don't
must
need
use
it.
It's actually better.
He took it back.
Oh, well, good for him. Well, I want to go ahead and speak about our next guest, Amelia Davis, and I call her a Marlowe Method success story, and she really is. But I'm going to take just a moment first to tell you about how I ran into Amelia the second time, because I got to know her well some years ago when she was coming to the hospital here in town when we were running the Marble Method classes. Well, years went by. Very recently, Debbie and I again did the Baton Memorial March, and
you have your
and I have my medallion for this year's march on today, and I feel very honored to wear it because, like we were saying in another show, it is an honor to be out there with the soldiers and with the dedicated people who are out there doing this march to honor those who actually did march in Baton years ago. So at that march a few years ago, Amelia, I'm not sure if it was like 3 or 4 years ago.
About 4 years ago.
About 4 years ago.
Right.
And I ran into you out there, and you recognized me, and I was amazed to see that you had done the walk. And I said, wow, it's great to see you have done this. And she said to me, well, it's because of the Marble Method I was able to do it.
Right.
And that's why I wrote about her in the book, to introduce her, because you actually were one of the main inspirations to me to write the book.
Thank you.
Oh, you're welcome. Why don't you take a few moments and just talk about your own wellness and your physical activity?
Well, when I came to Las Cruces, I weighed 165 pounds. It was horrible. I was wearing size 16 clothes, And I was joining Senior Olympics, and I knew that was not good for me because I couldn't keep up with the walks if I was going to be that heavy. And I happened to read about your program or classes that you were going to have. And even though I'm not diabetic, I decided, well, I'm going to take it and see what it's all about. And I was really very impressed because I didn't know what to eat or how much to eat. I was eating too much of the wrong foods. And that really taught me, to eat more vegetables and more fruit, less carbohydrate. And my husband is following what I do too, so that has helped him a lot too.
I didn't know about that part.
Yes, everything that I eat, he will eat. Everything I don't eat, he will also live out of the way.
Did he need to lose weight from the beginning?
He did, because he had hip surgery, and he was a little bit overweight too when we came here. And he wasn't doing too much walking, so that got him to walking too, to where he walks 2 miles every day.
Boy,
And
that's so good.
he has not taken medication for his hip problems, no pain, no nothing. So you have been a miracle worker. It was.
She is.
It was really, really wonderful for me to learn all those things. I was amazed because I didn't know.
Go ahead, Debbie.
I just want to make sure, Sunny, for those who might not have seen a previous program, you didn't say that, or maybe you did, I didn't hear that she learned this from classes you taught many years back before the book existed.
Many years back. Oh, yeah, we used a little handmade pamphlet at the time. Do you remember?
right.
Yeah,
Yes.
I want to say mimeographed it. That really dates me. But we copied it together and pasted, literally cut and paste pictures in by hand and made copies of that and stapled them together. And that's how we did that for years. And it worked fine. But Amelia, not everybody takes it so well as you do. I mean, I don't have the numbers on it. I have no way to follow up with people. It was a miracle, I think, that I ran into you, and I'm really thankful for that. And then I turned around and ran into you again twice recently. And so it's like God is tapping me on the shoulder and saying, bring her on the program because she needs to talk and let other people know about this.
That's right.
Because not everybody takes it that seriously and follows through like you did.
I wish more people did. And they asked me, why do you do the things that you do when it comes to athletics? And I was never athletic at my young age. And I said, to prove to you that you can do it.
Yeah.
You just don't say, no, I can't. You can if you try.
Yes, you sure can.
I went from a size 16 to a size 8.
Oh, wow.
And I wear size 8 and 10,
Yeah.
But
you stayed right there.
Right.
Yeah.
My son didn't even recognize me. He came from Seattle, and he saw me. He said, Mom, what happened to you? I said, I'm your little mommy again. Because that's what he used to tell me when he was young.
Yeah. So, Amelia, do you still use the marbles?
Oh, I don't use the marbles, but I sure listen and think about what I'm going to eat.
So you still follow Sunny's
Oh, yes,
method.
very much so, yes.
Yeah, because really, when you think about it, the marbles are only there to enable people to do the nutritional changes well and for a long period of time, and the physical activity changes. So once, it's like me, I don't use my marbles that doesn't come out right when I say it that way. I don't use my marbles every day. And my mom would really laugh at that as a teenager. For me, she would have agreed.
But it's a great method for, I still use my marbles every day.
Yeah,
Because
yeah.
it's a visual aid that I think really keeps all of us going. Obviously, you're very motivated, but I think...
And you haven't been on it very long.
No.
I used my marbles religiously for, several years until all of this was so deeply ingrained in me that I'm not interested in going off the program anymore. It trained me.
That's right.
Remember how we used to have the kits there, and I brought in kits of marbles, and oh gosh, one time when I was making the kits at home, I actually spilled a bunch, and my cats went crazy with marbles. I was picking up marbles for months afterward. I found, there's another one.
How many marbles did you say, Sunny, you had one time?
I had them in my house, 40,000 marbles at one time.
Oh, my gosh.
Yeah, because it's 400 for a kit, and I was making a whole bunch of kits. So let's talk about that for just a moment on how they work, because we really haven't touched on that in the program yet. You see that there are different colors here. The different colors mean things. I have a hard time getting these bright colors. Now we go to the dollar store or Hobby Lobby or wherever we can get marbles, and we just have to take what they have. But we used to actually order them from Vietnam, believe it or not.
Oh, my goodness.
And the yellow I used for the morning, and that's the way I taught everybody, bright sunny morning. The green was for the afternoon hours, because see, the whole day is broken into parts of time that we earn the marbles for. This was the evening marble from bedtime, after 6 o'clock until bedtime. And then the red one, because red seems vigorous, like activity, we use to earn for the exercise every day. And we also, there's more to it than just earning the marbles. It's not based on exactly what we eat. It's like, did we do the right things over that whole period of time in 6 hours?
So people who haven't bought the book, of course you need to buy this book, but they're probably thinking those marbles are for something totally different than what you're really using them.
Oh yeah, it's a behavior training program. And behavior training is really the essence of any permanent change that we're going to make and be successful with for a lifetime, not just a long period of time.
And Sunnie, I hate to cut you off, but it's already time for our Bible verse.
Well, let's go for it. And just in case we run short on time at the end here, Amelia, I want to thank you so much for being here. And I just hope I keep running into you forever, because it brightens my day every time that I do.
Thank you for changing my life.
You are welcome. Oh, this is great. The Bible verse is Psalm 71, verses 7 and 8. And here it is. We think probably it was David who wrote this. And he's saying, "My life is an example to many, because you have been my strength and protection. That is why I can never stop praising you. I declare your glory all day long," to God himself, of course. And so with that, we want to thank you again for being with us. We've had a wonderful time. It's been a great experience for us with our guests. And we are counting on you to stay well. See you next time. Hi, this is Sunnie Bell. I hope you're enjoying the program Staying Well with Sunnie Bell. To get your personal copy of the book to follow along with the program, it's available at the following locations: Oscar's Beauty Salon, Coas Bookstore downtown, Amazon.com, and you can get it from me. Thank you, and stay well.